patients can be misdiagnosed as suffering from unipolar or major depressive disorder when the correct diagnosis is bipolar disorder with depression for several reasons. One is that sometimes a person may suffer from one or more depressive episodes before they ever have their first manic or hypomanic episodes. So they don't know that this is not just a simple recurrent depression. They don't know that this is really depressive episodes resulting from bipolar disorder. That's number one. Number two is it may be a failure by the treating professional to take a good history. For example, when I ask patients, so have you ever been manic or hypomanic? No. Do you have a history of bipolar disorder or what used to be called manic depressive disorder in your family? No. And then I go back and I say, well, let's explore that manic hypomanic thing. Has there ever been a period in your life when you felt so high, so up, so good, so grandiose, so angry that people thought you weren't your normal self? Oh yeah, I have periods like that. And then we ask follow-up questions, and doggone if they haven't had hypomanic episodes. But some patients don't recognize that as abnormal. They recognize the depression as being depressed, but they think when they're hypomanic, oh, this is normal. This feels great. I get a lot done. I function better. I feel better. And they don't realize this is actually the hypomanic part of bipolar disorder. When it comes to family history, ever had anybody diagnosed in your family with manic depression? No. Well, the reality was 20, 30, 40 years ago, a lot of patients weren't diagnosed correctly with any mental illness. You have any family members that had periods of real highs and real lows in there? Oh yeah, Uncle Joe, you know? And when you actually question, what you find out is, doggone, Uncle Joe was bipolar. He just wasn't correctly diagnosed. So sometimes it's a failure to get an adequate history as well. And then manic, hypomanic episodes may show up later in one's disease history.